Hi, nice to meet you everyone. My name is Dr. Juanda Leo Hartono. I am a specialist in gastroenterology and hepatology, currently practicing at Mount Elizabeth Hospital at Orchard in Singapore. Colonoscopy is an endoscopic procedure whereby a tube with a camera was inserted through the backside to evaluate the inside of the large bowel or the colon. In Singapore, it is advocated that anybody who are more than 50 years old to go through colon cancer screening. And one of the tests that is more established to do that is by performing colonoscopy. So not only that colonoscopy can detect cancer, it can also detect precancerous lesions such as polyp. And by picking up polyps in the colon and removing it, the hope was that you can prevent or reduce the risk of colon cancer developing. Colonoscopy is considered a relatively safe procedure. The risk from colonoscopy includes bleeding and perforation. However, the risk is quite low. For bleeding, the risk is 0 to 2%, and for perforation, the risk is 0 to 0.3%. For those with inflammatory bowel disease or IBD, screening colonoscopy starts 8 years after the diagnosis of IBD. This is because the risk of colon cancer increases significantly after 8 years of diagnosis. For example, if patient's father has a colon cancer at the age of 48 years old, the patient should have a screening colonoscopy done at the age of 38 years old. Prior to colonoscopy, patient has to clear the bowel. This is done by taking medicated solution or liquid, and the patient will then have to go to the toilet and pass their liquid stool and results in a clean bowel. Before taking the bowel preparation, patient is supposed to be on low residue diet by avoiding nuts, vegetables and fruits. If patient take fiber as usual, this may result in suboptimal bowel preparations, and this can result in a prolonged procedure and more challenging colonoscopy. I had a 41-year-old patient who was found to have iron deficiency anemia. However, patient himself was relatively well and no symptoms. He has a family history of cancer, and because of the iron deficiency anemia, I have suggested to do gastroscopy and colonoscopy. When I did the colonoscopy, I found a large colon cancer, and fortunately it was still at the early stage and patient can be cured by surgery. This illustrates that everybody is different. And although the screening age is supposed to be at 50-year-old, we need to take into account the patient's symptoms, the conditions, as well as the family history.